Hi, everyone. Thanks so much for joining us today. And happy November Awareness Month, everybody. First day, someone said today, I can't believe it's November. Here we are. So it's going to be an exciting month. Thanks so much for joining us to kick it off. Today's webinar is called Time Matters, Advocate for Sotatercept in Canada, or as the title says on here, Raising the Volume. I actually like that one better, I think, Raising the Volume to support timely access for Sotatercept. In case you don't know who I am, my name is Kimberly Brunel, and I am the Director of Strategic Initiatives at PHA Canada. I am joining today's webinar from my home in Mississauga, Ontario. I'd like to just take a moment to acknowledge the lands which constitute the present-day city of Mississauga as being part of the treaty and traditional territory of the Mississaugas of the Credit First Nation, the Haudenosaunee Confederacy, and the Huron-Wendat and Wyandot nations. I recognize these peoples and their ancestors as peoples who inhabited these lands since time immemorial, and I am so very grateful for the opportunity to live, work, and learn on these territories. So welcome, everyone. If you have any questions throughout the webinar, as always, you know how we work. Just post them in the Q&A box. You're welcome to use the chat box if you'd like as well. We'll do our best to save some time at the end so we can get to all of your questions. Without further ado, I'm just going to pass it over to our speakers today, Joanne Chambers and Bill Dempster, and we'll tag team today's presentation. So I'll let you introduce yourselves.
Excellent. Thanks so much, Kim. So I'm Bill Dempster, and I'm joined here with Joanne, who will introduce herself in a second. And I'd like to just acknowledge that we're here in Ottawa and at the invitation of the Algonquin peoples, and that we're on their unceded traditional territory. So thanks for kicking that off, Kim. We're with 360 Public Affairs, a government relations and health policy consulting firm, and I've been doing this kind of thing for over 20 years now, and I've got a legal background, and I'm going to pass over to Joe, and then we can do just a little bit of housekeeping in terms of how we can all interact. And I see somebody's already in the chat, so good stuff. That's Jamie. You're really keen. Joe, over to you.
Good afternoon, everybody. I'm Joanne Chambers. I work with Bill at 360 Public Affairs. Very pleased to be here, and thank you to PHA Canada and Kim for involving us, including this in this webinar. We're very excited about presenting on this. We have been working with PHA Canada, in the past few months on different initiatives in order to help inform and engage some of our government officials on PAH and some of the new treatments. So very excited to be here, and I'll pass it back to you, Bill.
Awesome. Thanks so much. So obviously, lots of you already know how to use the chat. And I don't know, Kim, how interactive we want to make this. If people put their hand up and want to actually tag in, we've got 39 people on, so it is quite a number, but please don't hesitate to throw questions or comments into the chat. And if there's time towards the end to make it even more interactive and you can jump in verbally, then let's allow that. But we have actually a lot of material to cover over the next 60 minutes. I'm going to pass it over to you, Kim, to talk about why we're here in Sotatercept. Then I'll take back in to talk about the drug review process, and where that file is right now. Then we're going to pass it back to you to go through the PAH advocacy campaign that's underway. We'll together review best practices for political meetings and review key messages for political meetings, and then hopefully there'll be some time for questions. But please don't wait for the end. And now look, the chat box is already lighting up. I hope you're all just saying, hello, nice to be here. But in the coming slides, I'm sure there'll be some really good questions. Remember throughout this that there's lots that you can do to help move this file forward. This is going to be really important. We're hoping that this is educational, and some of you have some experience doing this as well. There's going to be two things. Some of you are going to be having political meetings with your local representative, your provincial representative, and then second, there's going to be opportunities for you to share, to send emails, to engage on social media. So we're going to do our best to get through all of that, and looking forward to seeing the magic that you're going to create after this is done. So with that, I'm going to pass it back to you, Kim, to talk a little bit about Sotatercept. And I'm driving the slide, so just say next or we're done when you need me to.
Yeah, sure. So I think you can, there you go. Perfect. So I thought it was important before we get into the advocacy portion of the presentation, just to maybe cover what sotatercept is. It's the reason we're all here today, and didn't want to assume that everyone knew what it was. So if you aren't familiar, it is a new treatment for PAH and some of the key features. So it is an activin signaling inhibitor. I know that's a really big word, so if it means nothing to you, that's okay. But what's exciting about it is it's an entirely new class of medication for PAH. And what that just means is it's just a brand new type of medication. We don't have anything like it on the market here in Canada. And it's a novel mechanism. Again, that just means it's a new and innovative approach. It's a new way to deliver the medication that potentially could address disease progression, which I think for anyone with PAH, that's really exciting. We're all very excited about it. In clinical trials, we've seen that sotatercept has significant benefits to people's general functionality, so how they function on a day-to-day basis, and also has some impact as well on mortality risk. It's given as an injection once every 3 weeks, which sounds pretty good, I think, sometimes compared to some of the medications that you're all taking every single day. And it can be added as an add-on. So if you're already on PAH treatments and you're thinking, oh, how does this work for me? It can be added on to what you're already taking. So it's very accessible. So the reason that we're here today, and Bill and Joanne will go into that in a little bit, is that this is an exciting new treatment available for many Canadians, and we want to make sure that it's going to be accessible to all as soon as possible. So we need your help to make that happen. So I'll pass it back to Bill and Joanne. If you have more questions about sotatercept, I've like really just given a Cole's notes to it. Please feel free to post it in the chat, and we can have some conversations at the end. But I'll pass it to the experts as to how we're going to do this.
Thanks, Kim. We're going to give you a really high-level overview of what the process is and why it's really important for the volume to be raised on this as it moves forward. And I think you're going to see it's relatively complicated in terms of the government regulatory evaluation, negotiation, and then funding. It looks like almost the baton is being handed between runners trying to get to the finish line. And they need the audience cheering them on to run faster and to pass the baton, because otherwise they're going to be busy doing other things, including looking at other medicines or simply not moving as fast as we need them to. And we created this infographic. Now it's got to be 8 years ago, a long time ago, and unfortunately hasn't really had to be updated in all of that time, really. You'll see the escalator on the right. That's actually for private plans. A lot of Canadians have access to private plans for their drug coverage, and it is a lot faster, although it does have that one platform at the bottom where they have to do their reviews and make sure it gets onto those private drug plan formularies. For a lot of rare disease medicines, including sotatercept, and those will need to be getting through the public plans in order for you to get access. And unfortunately, that doesn't have an escalator. So starting with Health Canada, they usually take between 6 months and a year to review it. Fortunately, August 2024 has been approved by Health Canada, so you don't have to worry about that. But Health Canada looks at safety and efficacy and quality. The difference is they pass it over to the health technology assessment phase, and that's in most of Canada. It's Canada's Drug Agency. In Quebec, it's called INES. And what they do is they look at a medicine for its comparative clinical, economic benefits. So they're going to compare it to other medicines that are available, and they're going to come up with a recommendation to say, okay, this should be reimbursed. This is clinically relevant compared to what else is available. And here's how cost effective it is versus other therapies. The most important thing there is to make sure that they give it a clinically relevant basis. And that's because if they say that there's some positive benefit to giving patients this compared to other medicines that are out there, even if they demand a very significant price decrease, which they often or almost always do, they say that to get this to be cost effective, it needs to actually reduce in price by X amount. At least then you can pass it over to the Pan-Canadian Pharmaceutical Alliance. And what that is, it's all of the provinces and territories and even the federal government drug programs that actually are responsible for a large number of Canadians, especially Indigenous Canadians. They jointly negotiate the pricing terms and the listing terms of all medicines that are coming through. And they've done this hundreds of times. And this is really where the next step is. The reason why we have two big hands trying to come together and all these flags is because this is actually where it gets really complicated. It's like they all have to agree on the pricing terms and the listing terms. And then they come up with those terms, and then they have to take them back to their provinces. And you can see the final platform here, the public and hospital formularies here. That's when that decision is implemented. They have to add it to their public formularies, and then finally, it can get down to patients. And we're going to spend a little bit more time talking about that. We're not going to worry about the tower here. That's the Patented Medicine Prices Review Board. That just regulates the ceiling price of what it can be sold for in Canada. That's not relevant to this discussion. So
Bill,
what is, yeah, go ahead.
before you go ahead, there's just a question about list. Can you define what you mean by listing terms?
Yeah, it's like funding terms. So for instance, every public formulary across the country on Ontario Public Drug Programs, for example, or BC PharmaCare, Fair PharmaCare, they list products. They actually have a list of funded products. And that's why when I say listing terms, it will actually say, at this price, this is listed. So, but the listing terms in reality is the net price, and that's what's negotiated by the PCPA. That's what I mean by listing terms, and that is not public. That's actually a confidential deal, which I was about to explain. It's a great question, though. It's so easy to forget. People don't think about like listing things besides my grocery list. Unfortunately, this one's way more complicated than my grocery list. So what is the Pan-Canadian Pharmaceutical Alliance and what does it do? It's a standalone Pan-Canadian organization. That means it's not, necessarily accountable to any one level of government. In fact, it's not even accountable to any parliament. It's a corporation that negotiates the prices of medicines on behalf of all Canadian public drug programs. Everyone's involved. And how it works is one of these jurisdictions puts up their hand and says, okay, I want to be the lead negotiator. So it's sort of like being the lead union member that's going to negotiate with the management and then bring it back to all the members and say, okay, are you going to ratify this? And they regularly go back and forth with the manufacturer to negotiate those listing terms or the funding terms. Jurisdictions can be in or out. Even if they're out, we won't know that externally. And they all have visibility on the final price. And so it kind of makes it hard for a manufacturer sometimes, to know what their eventual volume of potential sales might be in Canada. But that's just how it works in terms of how it's set up. So the first step is, are they going to negotiate? And that can take a certain amount of time. And then the manufacturer gets these negotiation terms. That's what it starts. And then they start negotiating. They go back and forth with offers. If they're successful, you have what's called a letter of intent. And it's interesting, that's a letter of intent. It's not a commitment to fund. So it's an option to list. But it's one letter of intent for all of the participating jurisdictions. And then separate agreements need to be completed with each interested jurisdiction to provide public access to the treatment. And if anyone's really geeky or interested or legal into contracts, we can send you like a sample product listing agreement, which is really what will put the funding on the formulary or make it accessible to patients. I want to talk a little bit about timelines. And this is where you come in. Remember when I said the baton was being passed and some of these sections of who's carrying the baton are actually going pretty slow. And I'm going to focus mainly on the most recent data here in 2022. The dark blue bar is 172 days. That's how long it's taking on average between when the health technology assessment provides its recommendation to, okay, fund or do not fund or fund with conditions. It's always fund with conditions. And when the PCPA decides to start negotiations. Now that 172 days should actually be much closer to 6 weeks to 3 months. Like it's supposed to be very short, but it's actually double what it should be. And they very rarely make it within the timelines that they're supposed to do. And then the gray bar there, 189 days, that's how long on average it takes to negotiate. And unfortunately, of course, that's far past the timelines that it should take to negotiate these things as well. However, if the people who are responsible for doing this have more people in the stands around the Olympic Stadium as they're running around the field or in some ways walking, they're going to move faster, and that's where you come in. But I want to show you a couple more delay slides. The number of negotiation, and that's what's, after you get the letter of intent versus under consideration, maybe we'll start. It's really 29 to 2023, trending up in terms of those bars. I know Q3 looks a little bit better last year, but we're looking for more data, and it's just not where it needs to be, and it's certainly not on target.
And Bill, if I can just jump in on that one, I think the key thing for 2023, if you go back to the previous slide, is that you can see in the light blue in the graph on 2023 that the number of products that are waiting in that queue, that are waiting to be picked up for negotiations, are much higher than they used to be. So the queue for waiting to be negotiation is growing, and that's one of the concerns. We don't want products just waiting there. We're hoping that PCPA can jump in and start negotiations more quickly so that access can be provided more quickly.
Awesome. Thanks, Joe. Yeah, see, it used to be 6, 11, 13, and now it's like 26, 33, 39. That's true. Again, not spending too much time. I think we can send this deck around afterwards, but the point is that just a minority of files meet the targets that are actually listed on the PCPA website. And actually, they just updated this dashboard today, I think, unfortunately. So, but they're still not meeting their timelines. So your mission, if you choose to accept it, is to encourage them to meet their timelines for Sotatercept. So what happens after PCPA? Each of the public drug programs, and this is just the provinces, and there's the territories, and there's the federal government as well, they identify which products they put onto their list. Some of them, unfortunately, actually conduct their own reviews. So British Columbia does its own separate review, especially when it comes to rare disease drugs. Ontario has the Committee to Evaluate Drugs. Not all medicines go through that separate review, but they often do. And what provinces are looking for, and they're actually feeding to the negotiation systems, are budgetary capacity. Can they afford this based on what's happening with other priorities within the government, and not just health. Sometimes some provinces are thinking about this more broadly as well. What's the clinical criteria? So, are there ways that they should potentially limit access to it by saying it should only be used for these patients that have these characteristics, or should physicians have to write extra notes to be able to get access, or certain specialists only can prescribe? And then what's the price of each dose or annual use? And for something like this is of course a chronic illness, and so it's annual. And how many PAH patients are probably going to want to get it? A lot of this data comes from the manufacturer. They submit it, and then they of course calculate it on their side, and then this actually drives the negotiations. The timelines to reimburse a product, even after it's been negotiated, the terms have been negotiated through PCPA. It's very different, as you can see on this graph here. Prince Edward Island traditionally has been the worst. It's getting a bit better. It actually got some money to get that number down, but it is quite varied. And I think the updated data would show that Ontario is getting a bit faster. Quebec has always been really fast. But this is very important to cheer them on to get things going faster. And I see a couple of things in the chat. Is that a
About
good?
the BC review system, Jamie was mentioning, Bill, that it might be reviewed, Sotatercept, it should be reviewed by the regular system, not the one for expensive drugs for rare diseases. So reviewed by the BC Drug Benefit Council.
Yeah, I mean, Jamie, I would argue that's a good thing, because the expensive drugs for rare diseases, it's a very fixed pie. And so every time they actually take a slice out of the pie for sotatercept, they have to kick something else out of the pie, or they have to hammer down the price to like impossible to actually pay for that slice of pie. So BC Drug Benefit Plan, the normal system, is actually not to say that they have an awesome pie. It's also pretty tough in BC. It's kind of sucks. But to some extent, I'd argue, and I think Jamie's in there, it's better. Yeah. It's a great question. So this is the last slide in this data, and then we're going to pass it back to Kim to talk about the campaign for all, what you're going to do in Cheer. We're only comparing, this is published data, what happens in Canada for orphan drugs or drugs for rare diseases versus what happens in Europe. And they took a snapshot of 5 years, and they found 63 drugs that have European medicine approval. So it's being sold somewhere in Europe, and it's got an orphan drug designation. In Canada, we don't even have orphan drug designation. Doesn't matter. It's a rare disease, like PAH. 63 were approved there. Only 44 of those were approved in Health Canada. And then of those, only 30 got a positive health technology assessment review. So that even made it an opportunity to negotiate to PCPA. And it was even narrower. Only 20 got that positive recommendation out of the Quebec Health Technology Assessment Agency. And then only 24 of those medicines completed the PCPA negotiation. So you can see we go from 63 drugs. Canada only got public access to a third of those. And I think that the trick and the responsibility and the focus of what we're trying to do today is to make sure that one of those medicines, when this review happens in a few years again, happens to be Sotatercept. So I'm going to pass it back to Kim.
Bill, before we pass it back, there's just the one comment or question in chat. Somebody's asking, could that be applied to other provinces? I think they're asking about the review system in BC, how Sotatercept will be reviewed there, whether it could be applied the same way in other provinces. And you've explained how it differs a little bit in each of the provinces, but could you maybe just highlight that point again?
Yeah, thanks, Joe. It's each province has their own review system and timing for when they actually put it onto their formulary. BC and Alberta have committees around what they call expensive drugs for rare diseases, EDRD. Ontario doesn't. They have their own committee to evaluate drugs. Sometimes it goes through there if it's a really special case, but it's totally province dependent. It really depends. In Nova Scotia, for example, they will get the letter of intent, and then the Ministry of Health will say, hey, put all of these drugs in sort of a holding tank, and we're going to, prioritize them and list them all at the same time when we have more money. So it's really driven more by finances. Bigger provinces like Ontario have a little bit more flex in terms of their budgets. Like we're talking, a $6 billion budget in Ontario versus a couple $100 million in Nova Scotia. So you can do a lot more in Ontario to move faster. It really is super province dependent. If we can find anything that sort of explains that, if you're interested, we'll definitely circulate it. I think there's something that a think tank did, the CD Howe or McDonald Laurier, might be a bit dated, but it'll generally give you the gist of how each province sort of tackles these things. All right, Kim, over to you.
Thanks, Bill and Joanne, for providing that great background. I wouldn't have been able to cover any of that, so I appreciate it. I appreciate, Bill, the call to join the mission, I think you put it. So let's talk about what that mission looks like for us. I think you've done a great job of explaining the PCP negotiations. So we know that they take time, and we don't have time. So what we really need to do is to encourage those decision makers to expedite those PCP negotiations so that we can get Sotatercept into the hands of those who need it as soon as possible. I will just mention that when I talk about the advocacy campaign as we move forward, Quebec is currently not included in this campaign. As Bill mentioned, they work under a different agency called INES. They're a little bit behind in the process, and so we're going to wait until they make those decisions before we include them in the campaign. So just wanted to flag that they wouldn't be in the advocacy campaign at this point. I think you can move me forward, Bill. Thanks. So there's going to be lots of ways that you can get engaged in this advocacy campaign. I'll mention that the campaign is called Time Matters. This took some brainstorming on our part, but this really came down to what it really is about, that it's the time to do it is now. We don't have time to wait for this drug. We need it. You'll notice we mentioned the Time Matters campaign. So there's lots of ways to get involved. One is a letter writing campaign. So you'll notice that this letter writing campaign will show up on our advocacy page. It's not there yet, but it'll come in hopefully late next week. It's a really great, easy way for anybody to get involved. You'll go to the site, you'll put your name, where you live, you'll put that information, it'll automatically populate who your health minister is and who your provincial representative is. It'll automatically populate them, and then a letter will go out to them on your behalf, and it'll be asking them to expedite the process. The great thing about this letter is that you can share it with friends and family. It is PH Awareness Month, so it's a great time to not only share your story, but also, ask for fundraise for the 6-minute walk, or ask if people can perhaps take just a moment to put their name and sign and send a letter to the representative in their area. You can send this by email, you can use social media. It's a great way to get other people involved. And the more, as Bill mentioned, we can bombard the system to let them know that this is important to us, and we can put a little bit of pressure, it's going to hopefully help to move things forward more quickly. Next slide, please. And for those of you that are interested in actually getting some face-to-face time with those representatives, there's going to be opportunities to do that. So we will have advocates across the country, just like yourselves, who would like to request meetings with their local representatives. We're going to have a lot of resources available on the website that you can use to help do that. So you might be thinking, I have no idea how to do that. I probably wouldn't either. But we'll provide information on, first of all, how do you find your local representative? Where are they? Who are they? I know we're in the middle of elections in a few provinces, so we'll do our best to keep that as up to date as possible. We'll provide you with an email template. So once you figure out who they are, we'll have a template for you. So all you have to do is fill your information in and then hit send. It'll give them all the information as to why you want to meet. And then if you do get the meeting, we have a proposed meeting outline sheet. So it'll tell you sort of what you might want to cover in that meeting. You'll have some fact sheets on PAH and Sotatercept so that you can walk into the meeting prepared with everything that you need. And then really what you're asking that person to do is to send a letter to the health minister and ask them to expedite the negotiation. So we will have a draft letter that you can give that representative to say, I want you to do this on our behalf, and here's a letter that you can just take, put your name on, and send. So the idea here is that you'll have all the tools that you need in order to do this, and sort of everything to help sort of expedite the process. And of course, you'll have us. So if this is still a lot for you to take on and you have questions or need support to get those meetings booked or not sure what to say in the meetings, you've got our support, and of course, Bill and Joanne as well. So we'll help to get you prepared for any of those meetings. I'll mention though, why don't we go to the next slide and I'll talk about what we're going to do at Queen's Park. So, for those of you in the Greater Toronto area, we will be having an advocacy day at Queen's Park. I know some of those advocates who will be there on the line today. So, we'll be there on the 20th and 21st of this month. And so, what we'll be doing is, with the support of Bill and Joanne, we've been able to book several meetings, if not more than that, with local representatives here in Ontario. And we'll be having those in-person meetings on those 2 days. So, if you are a part of that group, you don't need to book any meetings because we're going to do that for you. If you live in the GTA and you haven't heard about this yet, but you'd like to join us on the 20th and the 21st, please, you can post your name in the chat or just reach out to me. We'd love to have you. Again, we'll provide more training for those who will be doing those days in the coming weeks. So those of you involved, I've emailed you, but if you'd like to be involved with us, by all means, let me know. We'd love to have you to do that. Next slide. And another way that you can get involved is sharing your story with the media or on social media. Again, it's PH Awareness Month. It is a great time to get the message out there about your life in purple and how PH impacts you. And this is a great time to have this ask. So if you do want to speak to the media, again, not sure how to get started, we'll have a form on the website on our advocacy page where you can fill out. It'll let us know that you're interested in doing some media work. We can provide some training for you to get you ready to do that and find you an opportunity to speak out in your community. If you would like to use social media, we'll have a series of pre-scripted social media posts that you can take from our website. It's really easy, just copy, paste, make sure that you tag your provincial health minister, make sure you tag PHA Canada and use the hashtag Time Matters PAH. So there's lots of ways to get involved, from the letter writing campaign to social media to media. And then, of course, if you want to try to book an appointment with one of the representatives of your community, that would be great. PHA Canada is here to support you in all of these ways. We will have a dedicated section in our advocacy page that'll have all of the tools that you'll need to do that. And again, if you need further support, please know that we're here to do that and happy to help in any way that we can. And we need your support. This is the time that we have to rally together and really try to push to get this this not waiting, what was it, 182 days. We need this sooner. So I'll stop there and I'll pass it back to Bill and Joanne. But if there's any questions, please feel free to post in the chat.
Awesome, Kim. There was one question in there about, writing more than one letter from individuals, and generally no, but maybe like in terms of that letter or email. But one thing you can do is use social media too. So there are lots of different channels to get in there. So I don't know if that explains it, Kim, or if there's anything else you want to jump in on there on.
No, I think that's right.
Okay. Good. Okay. So best practices for political meetings. You're going to be asking for meetings from your local representatives, and some of you are going to be coming to Queen's Park, and some of you may have even come to Ottawa recently to participate in those meetings. These are just really high-level tips and tricks to keep in mind when you do get the meeting. And it can be a bit intimidating, but you'll find that your local representative, actually anyone looking for elected office, is really happy to meet with constituents, because you are a voter and you have family and you're part of communities and you can talk to other people. So you're going to find, if you haven't met them already, that they're often very affable, interested, and engaging. So one thing is they're going to want to know about your personal experience. That's actually much more effective, certainly to lead with, than talking about the statistics about the hundreds of days that it actually generally takes to get through the system. But we recommend starting with a bit of a background in terms of PAH and the challenges. Even calling it PAH, not to unload it with a full acronym. Try to make it as simple as possible, but explain what the disease is, how it affects you. Try your best to use good analogies, and then this is something that we can practice, and that we'll talk a little bit about later in the key messages. But You heard me talking about like, a baton, passing it back and forth. Like one of the other things that I thought about with PAH when I first learned about it working with Jamie and the team was it's like a garden hose and you can't get the water through. And so the pump just gets bigger and it has a huge effect on the size of the heart and it has all of these issues that you can just imagine if you were trying to push blood through a garden hose that was clogged up, because otherwise they won't really understand the biology and the big challenge that you've got. Um, have a two-sided conversation with them. So pick up some cues about their experience with some big health issues or other rare diseases, and encourage them to share those stories, because then they're going to be more on your side and actually want to do what you're going to ask them to do. What to do before the meetings: rehearse, practice a bit, in front of the mirror, in front of a partner or a friend. Uh, Rehearse your personal story, keep that as tight as possible, uh, and then make sure you get to the key messages. If you're going to Queen's Park, there will be a formal gate to get in. You have to bring a license or some other kind of ID. It might take a little while to get through because there's often other people like you trying to get in for their meetings. If it's at a constituency office, there's generally less security. So I still would recommend coming 15 minutes in advance, because you may be waiting for a little while. For virtual meetings, get on the meeting a bit early, make sure there's no technical issues. They actually like virtual meetings too, so don't be shy about doing them that way if you can't get them in person. When you're in the meeting, start with an introduction about yourself, explain that you're representing PHA Canada and what that organization is. Always confirm how much time they have. Sometimes they're running late from other meetings. If they have 15 minutes, do it in 15 minutes. The general rule or gist is about 30 minutes per meeting. That's how much they generally allocate to these meetings. Again, share your personal story. Make sure you get to those key messages and asks. Take notes. If you're there with somebody else, and plan in advance who's going to take notes. If you don't know the answer to the questions, look, I don't know, but that's a really good question. Bring it back to Kim and the team, and then thank them. If you're there in person, they're going to want to take a picture with you. If there's a Canadian and a provincial flag, that's where they're going to want to take the picture beside. They may actually, and they're going to ask you, hey, can I put this in my shout out newsletter that I'll send next week to say I met with this amazing person named Jane Stranovsky, and they can't wait to be able to let everyone know about it. What to do after the meetings: bring those notes back to PHA Canada. When it happened, who attended, what happened, and any follow-ups that they need to know. So just send it to that email address. You're going to send a thank you email to your representative with the draft letter. So there's going to be a draft letter for them to send to their health minister. So who's actually their colleague in the legislature. And then there might be some other follow-ups from your meeting that you're going to bring back. If there's a picture taken and you got a picture too, put it on your social media account and or send it to PHA Canada and tag PHA Canada, as you've got the at PAH Canada is the handle that you'll want to use, as well as Time Matters PAH. That's the hashtag that's being used for this campaign. And if you try at political official, that's not a real handle. You have to replace that with the actual person. Please don't try to just cut and paste, because otherwise it's going to get really confusing. No one's going to read it. Key messaging. Oh, Joe's tagging in. Yeah, want to go back
I
to
just
that?
wanted to add that Jane had a good point in the chat about if you have virtual meetings, take a screenshot if they, ask for their permission, but take a screenshot of the image, and you can also socialize that. A lot of people are doing that now that we're going more virtual.
Yeah, it's a great idea. Key messaging. I'm going to pass it back to Kim. You're going to walk this through, I think, or we're going to do it together. Over to you.
Oh, all right. Sorry. There we go.
Oh no. Well, we can tag team on it.
Sure. Do you want to start? Do you want me to start?
Well, why don't we I don't know. We're not going to practice. That would like to be too silly because you're reading it. I was going to say we could even pretend. Let's pretend I'm like a legislator. And you're just coming in to explain the PAH. But let's stick to a little bit to script. Walk us through this.
Sure.
We won't role play. Go ahead.
Yeah, I think some of these top points are ones that the community are fairly familiar with. We're talking about the fact that it's rare, progressive, life-threatening. We talk about how it affects the arteries in the lungs. We talk about how the complication, what it leads to, how it causes mortality. If left untreated, we know what that causes. We talked a lot about how many Canadians it affects. So just those important stats, just to give that big picture of what PAH is, and how it affects you. And then we've talked a lot about telling your story. And for those of you on the call, we were doing this in Ottawa a couple of months back, and those were really the pieces that were crucial. And those were the ones where you saw people leaning in to the conversation and really being able to tell your story and how it has impacted you is really what's going to build that relationship and get them interested in wanting to support the work that you're doing. The bottom three are really talking about treatment options that we have. Where are we with PAH? And again, you'll have information about sotatercept and why it's important and how it's going to actually impact the PAH community. If it's not an impactful medication, it isn't going to make a big difference. It's going to be a hard sell. But we know a lot about this drug and we know how important it's going to be. So really selling that story about why it's important and why it's so timely and what kind of impacts it can make on patients' lives in particular. And I think there was someone in the chat that had mentioned the cost, and I think Jamie pointed out a good point that a lot of our patients are unable to work due to their PAH. And with this medication, we can see that there's great quality of life. So there's return to work, greater impact on the economy. So we'll have a lot of those stats available for you. So again, really just the background of what PAH is and then why this medication is important. And again, that asks, so where are we? And we really need you to do this so that we can expedite this process so we can benefit from this wonderful medication. So, and then of course in there really tying in what your story is, how it has impacted you as a patient, as a caregiver, as a family member, however it impacts you, but really having them understand why this is important and how it can impact you to be on sotatercept, to benefit from the medication, and what you would like to see it do for yourself or for your loved ones. Sorry, Bill, I went farther
That
on.
that's excellent. And we've got a few questions from Joan. We could. I'm going to say I'm answering them live and then press that button and
Can
see
you
what
read them
happens.
out loud? Because I don't think everyone can see them, Bill.
Yeah, for sure. So, in addition to asking provincial members to send a letter, should we also ask them to raise a question in the House or ask an order question which requires the ministry to prepare a response and or submitting a petition on our behalf? And Joe, these are really good questions. You should definitely be in government relations if you're not already. Um, yeah, I don't know, Kim, if you want to jump in. Those came up in Ottawa, and I can supplement.
I think you're best to answer this than me, Bill.
Sure. They all of them are like if you can ask them to raise a question in the House. They may actually say, I want to do it anyway. And the same thing with putting a question on the order paper, which does require the health minister to respond to it. These are all good potential additional tactics if they're really keen. The one that we're focusing on in this campaign is writing a letter to their health minister. We might want to save those broader, more public in the legislature tactics for a time when if things start to stumble or really get caught up in the bureaucracy. Right now, we're hoping that with this cheering on, it's actually going to work. That said, if they say, "Look, I'm super keen. I want to get involved. I want to do more than just write a letter," like, of course, don't say no. Don't do that. And say, "Here are my key messages. Let's go back and forth and get back to Kim, etc." Um, the second question is, I'm going to press that button, answer live. Okay, good. How do you suggest we find out information about our provincial rep before our meeting? And so, Kim, you tackled that earlier, I think.
I think so. Joe, maybe I didn't enough. Joe, maybe in the chat, if there's something more specific I didn't answer, Joe, do you want to put it in the chat so that we can answer that?
Yeah. It's going to be available on the website, sort of
I'm
how to get in touch with your, like, how to identify your member, right? That's what you said.
I'm wondering if Joan's referring to their background, like maybe what they're interested in or what other issues they've
Yeah.
become passionate. Is that maybe that's more, how can we find out more about, what hot button topics might be good to bring up or what they have been passionate about before?
Yeah. And what we do there is we Google, to be honest, to start, and then you land on their website, and then they have a biography that's there. And if you want to sort of Google around issues that are important for you, um, put their name with rare disorder or put their name with respiratory issue or cardiovascular, and just I mean, there are literally thousands of members across the country. We'd love to have PAH bios for all of you at all times, but you're going to do such a good job that unfortunately you're going to have to do a little bit of the homework before you go in. Although, we'll see. I think there are some that we can tag in on.
For sure.
Yeah, these are great questions though, Joan. Before you get in, like we should add that as a bullet, like do a bit of research to find out, like they might be on a board of a local hospital foundation. And and then you can actually tag that back in and say, hey, that's where my specialist is. I know you're on the board, or you were. That's a really good point. And then lastly, is there going to be a strategy to find patients who live in the provincial minister's riding so that we can have in-person meetings with the minister? I shouldn't say lastly, because then of course the Q&A section just blew up. So anyway, Kim, do you want to answer that now in terms of how we're sort of identifying and the right people to go to these meetings?
We're doing that currently right now for our in-person at Queen's Park. But yeah, I think moving forward, this is something we can definitely look at doing. I think we'll have to see how things go here. And then as we move forward and as decisions are made, definitely look to see where we can strategize in other parts of the country. Um, that would be my answer. Bill, would you add to that?
Yeah, exactly. So just keeping an eye on the clock, let's get back to the key messages. And there's gonna be other webinars like this and opportunities. So we may not get to all of the Q's and A's. You guys are awesome. Keep it up, but just heads up. Back to you, Kim.
Oh,
Finish off the key
sorry,
asks.
I was reading. Okay. Yeah, so we've talked about what the key ask would be. So again, you're really asking them to contact the health minister, which again, I think Bill, you brought up, you pointed out, these are their colleagues, encourage them to get involved on the file and ensure that we expedite this process. And again, you'll have a letter that you can provide so they don't have to come up with the information themselves. It's all right there. You'll also have PAH information, so Sotatercept information that you can leave with them so that they can read a bit more about it after you've gone once they have a chance to digest the meeting and want to pursue more. And of course, they can always reach out to us to get more information. So again, you'll give them that draft letter and then following the meeting, share the letter. Remember to ask for a copy of the letter and we'll provide a draft template of that on our website. So
Amazing.
that's what you're asking them to do in essence. Any questions on that in particular?
Well, now we have time for Q&A. This is the last slide, Kim. We're in good shape here.
Yeah, trying to read the chat and look at the questions.
There was a good.
Yeah, Marion, a good point. Yeah, those who are in support groups across the country, Marion in London, support groups can be great at helping with this. So if you're a support group leader or you meet with other PH patients to bring this information to them and see perhaps how they'd like to get involved or to support the work that they would like to do. And again, I'm always happy to help do that as well.
I see a lot of questions in both about the cost of a transplant and just a bit of background from another issue area. We've done a lot of work with cystic fibrosis, and of course, they've got access to a medicine that's actually taken a lot of CF patients off the transplant list. And that opportunity to avoid a transplant, really, if that it does resonate with them, they may have experienced similar advocacy on that other medicine that actually got through. It was a big push, but it is an issue for them, and a lot of people know people who have had transplants and know how like heavy duty it is, how expensive it is. Um, you don't even have to go into the detailed numbers in many cases. Uh, but you can talk about all of that, the surgery, hospital stay, the medicines to keep it, keep the transplant actually, working. Um, if we can push that off or avoid it for as long as possible, and if this can actually, then that's a huge savings to the system, and of course it leads to better health. So, federal health minister, somebody went to high school with Minister Mark Holland.
Great,
That's
Kirsty. Kirsty's going to be joining us in on Queen's Park. So there we go.
That's amazing. Yeah, don't talk too much about that because, of course, Queens Park unless you're meeting with the Liberals, it's a conservative government. But yeah, go and bug Mark Holland about this in terms of the drug to rare diseases strategy and potentially getting access. And I mean, he's got the biggest health podium in the country. So if he can talk up communities of Sotatercept with an old high school, you know, friend, then I don't see any harm in that. If you do that, Kirsty, though, let's make sure that she gets the messages that we used for Ottawa because they're a little bit more
I was going
relevant
to
to
say
that.
it's a, a little bit different, and there may be an opportunity to sort of encourage him to sign a deal with Doug Ford on providing funding for rare disease, which could help, accelerate access to sotatercept. So there could be some messages there that we'd be happy to help support on.
For sure.
Yeah. So yeah, British Columbia, you've got somebody with a new in that seat. Their level of knowledge will be very low, but the advantage of a new parliamentarian is that they'll be very keen and they don't even know where the bathroom is. And if you have an idea about, what they can actually do after they find the bathroom, they might be even more receptive than ever. We know my best example is
Yeah, they're keen to progress.
yeah. Do you remember Rechi Valdez, she's now a minister. She's from Mississauga. But when she was first got in, she was a nurse by background. She was like super keen to like do everything. I'm going to change the world, get them then before they become, jaded, crusty, old politicians.
Yeah, I agree, John. I think it's probably in your favor that they're new. It's a good time to put an ask in. So I think play off the fact that they might be keen and are willing to sort of pick something to start with. Hopefully this one ignites a fire for them and they're keen on it. No, don't tell
Yeah,
them to vote for him. No.
no.
It's a good tip.
Yeah.
And if they're smart, they won't ask, but they may ask you to vote in the next election for them. You never know. Um, yeah, any other questions or things that
I think I might just mention where we are in the process. So I think Bill and Joanne gave a good overview of all the different agencies involved. But at this point, we are waiting for the Canadian Drug Agency to provide its final recommendation on sotatercept. So we've received a preliminary and everything looks great. We have no reason to assume that things won't go along well, but we're just waiting for that final recommendation, which is anticipated to come in hopefully soon. Once we have that, we will officially launch the Take Action, that's old, Kim. The Time Matters campaign. I'll end up doing that a few times. The Time Matters campaign. So we are just on a bit of a hold. So you may go to our advocacy page and think, gosh, there's none of this stuff is there yet. It's there and waiting. We just haven't launched it officially, but we just need to wait until that final letter comes in. And then as Bill mentioned, the baton gets sort of passed to the PCPA and the provinces and territories to take over. So that's where we come in. So as soon as that happens, we will launch that page and then we'll let you all know when that's available, which means the letter writing tool will be available and all of the other resources that we've talked about will now be available to you. So we'll keep you posted as soon as that goes live.